Okay, I think we're ready. Hello, everyone. Thank you for joining us today for our live webinar to discuss adult ADHD with the Counseling and Creative Therapies Department. My name is Donna Davis, and I'm Associate Director of Admissions here at Marylhurst University. I'll be your moderator today. And we are joined by Professor Greg Crosby. He's one of our Marylhurst faculty, professor in psychology and mental health counseling. And also Dr. Tara McGarry, program director of our psychology program and our mental health counseling program. So let's go to the next slide and let's see what our agenda today. We're going to talk primarily about adult ADHD. We're going to talk about psychology offerings here at Marylhurst, and we might mention a little bit about our new Master of Arts in Mental Health Counseling as well. And if you're so moved to begin the application process to become a student here at Marylhurst, we can answer questions about that too. Just a couple of little housekeeping items. You will have a chance to ask questions toward the end and kind of make note of those questions. Professor Crosby is going to present some really, really great information. His classes are always full. I will just say he has quite a following, and you're so lucky to be able to listen to him today. But hold those questions toward the end, and there'll be an opportunity for you to type those in the little Q&A comment box over to the right there of your screen. You won't need to take notes necessarily because those of you who signed up for the webinar will be sending you a copy of this in the email afterwards. So we will address some of those questions toward the end. I think that gets us started. I'm going to turn it over to Professor Greg Crosby.
Well, thank you, Donna. And I want to welcome you to this adult ADHD seminar. I have taught at Marylhurst for 37 years. So what I'm going to do is share with you some of the information I have based on our co-authored book. That is with Tanya Lippert and myself. We wrote Transforming Adult ADHD, which is on your screen. And we did this in groups over a 25-year period, and then we decided to write a book on it. Now, you're looking at a PET scan, and one side is ADHD, the other is not ADHD. And in the no ADHD, you see in the orange activity is a lot of glucose activity, electrical activity. In adult ADHD, in your low interest area, you won't have the electrical activity. It will be greatly diminished. So it is hard to pay attention to things of low interest. However, the interesting thing is that if you have a high interest activity in your ADHD, you will look like the no ADHD when you're in that high interest. Let's say that might be a video game, or that might be music, or it could be reading history, if that's high interest to you. So what is happening in adult ADHD is not just attention deficit. It is changing from high interest to low interest. So the problem will be about under-focusing in low-interest activities, over-focusing in high-interest activities. So what we need to do is look at how we can actually stop the high-interest activities, which can be our creative edge and strengths, and how to start the low-interest activities, which may be something like writing a paper, paying your bills, finding your keys. So what we looked at in these slides basically is a marked reduction in electrical activity in low interest, and then it's difficult to formulate plans and strategies in the low interest activities. That's why we lose things in low interest, like where are my keys, where are my shoes, oh, the paper is due, oh, I need to pay this. You're constantly worrying because you are forgetting. So anxiety comes with this problem at least 40% of the time. And then you get depressed because you're losing things, so depression will activate it further. So often people, at least 40% of the time, who have ADHD also have depression, anxiety with it. And so the reward pathway that seeks novelty will try to wake up that prefrontal cortex. So if you're sitting in a conversation and you have adult ADHD and you're bored, you may interrupt people too much. You may bring up really novelty items, which could be very interesting and make you very engaging to talk to. Did you know how much the Arctic is melting during a family gathering? And it's always a way to wake up the brain here. So to understand the need to wake up the brain, we need to look at evolution. And Tom Hartman has a book called Adult ADHD, How to Succeed as a Hunter in a Farmer's World. This became the most dominant anthropological theory. He is a counselor himself in explaining adult ADHD. So we were walking 10 to 12 miles a day, went about 10,000 to 20,000 years ago. So exercise actually regulates your attention and regulates your dopamine level. And dopamine is the pleasure hormone neurotransmitter that actually engages focus but helps with pleasure. So in other words, it's a neurotransmitter of learning and pleasure. Very interesting. So as society evolved into a hunter-gatherer, our walking became seasonal. Our movement and exercise became seasonal. So we would have robust periods with the harvest and with planting and with summer. And then we would settle down to winter. And so you would have, unless you started to exercise, you would have this big change in your ability of regulating your dopamine. Now, this is more of a stationary environment than we have ever experienced. And what makes this so difficult to leave this stationary environment is that the internet, you're seeing so many images on the internet, or if you're playing video games, it's like your motor cortex is activated, but without the benefits of the biological changes of physical movement. So what is happening here is that our brain is literally getting rewired into surfing for urgent needs to wake up the brain. So we're going to take a look at some general ideas about ADHD. This is the interesting piece. It used to be called ADHD/ADD until 2013, and now everything is assumed under the heading ADHD. So you can have ADD, you can have ADHD, and you can have the combined piece. In adulthood, the combined piece is the largest, that you actually have the adult ADHD and ADD together. Now, the fascinating thing is, prior to 1994, it was thought to only be a childhood disorder. So we've been diagnosing adults since 1994 inside counseling offices and medical offices on child criteria. It was 19 years later that changed. It could have changed a lot sooner in the DSM-4R, but they decided not to make that change. So, as a result, a lot of people are perplexed about this disorder because it actually was being, the criteria was being used was to diagnose children, not adults. So it's got more clear since May 2013. But we have a 19-year history here of actually using criteria that isn't meant to fit adults. So the DSM finally has this adult criteria, and you need you need 5 symptoms, and it's age 17 and over, and the symptoms need to be present before age 7. Now, why is this important? This was shifted because the age before was the symptoms had to be presented before age 12. And anyone hanging out with kids knows there is a developmental energy difference under 7 and under 12. And so this allows, I think, for a more accurate look if you have this tendency. And this is one of the few disorders that if you are an adult, you have to have some indication you had this in childhood. And so that might be through report cards, through parents' reports, your own self-reports. So there needs to be a clear evidence that symptoms have persisted for at least 6 months. Now that is important. This isn't just 1 week. It's 6 months, and they clearly have a negative impact, impairing functioning in your social world, friendship, occupational, or academic. So in other words, it can't be just one setting. It needs to be 2 or more settings. So this is how to properly get the criteria for a more accurate assessment and diagnosis. So what interested me, and why I put this up here, is I worked in a medical system for years in Kaiser Permanente, where I developed this group, is that medical conditions can contribute to this. So you really need a very good assessment, and that may mean talking to your medical doctor, not just to a counselor or a psychologist. So here are some main ones, and I put the number one up at the top, sleep disorders. And the number 1 inside sleep disorders is sleep apnea. New York Times ran a Sunday front page piece that was 4 pages long several years ago on the biggest misdiagnosis inside ADHD, and it was sleep apnea. And any of you knowing about sleep, that if your sleep goes, it really, and you have problems with sleep and not enough sleep, it dramatically affects focusing and attention. Other conditions are cancer, chronic pain, heart disease, allergies, head injuries, and medical list is quite extensive. Now the importance here from a medical standpoint is this may change what kind of medications you're on, but it doesn't change the skill set you need. And I'll be going over the skill set before we end this 15-minute presentation. Now, in mental health and addiction, that also affects attention and ADHD. So substance and drug use can certainly aggravate it. Many people may try to medicate themselves with stimulants who have ADD themselves. A piece up there that, with addiction, and this is prominent, and that's gambling. And when we're looking at the psychological profiles inside pathological gambling, ADHD is very prevalent in this, because you're trying to wake up your mind through this randomness of the wheel. And if you get the win, you get really awake. And if you keep losing, you chase it and you move into gambling problems. That can be a problem if you don't learn how to manage this, going into substance abuse, drug abuse, and gambling. Depression, bipolar, all anxiety disorders bring inattention. Autistic spectrum has inattention built in to it. Psychotic disorders, and many others. So here are some just basic common characteristics, and I think you probably know these, but part of my job is just to summarize it, is you have poor impulse control. And then there's the problem of starting a project and ending a project. You begin projects without planning, a lot of enthusiasm, and then all of a sudden you stop. And there's significant difficulty with following through with deadlines, and especially in low interest activities like paperwork and filing and phone calls. It's almost like for ADHD, you can't figure out why you feel like your brain's turned off, and then why all of a sudden it's active. But if you follow your low interest and high interest, that's why. The low interest will turn off the brain the more you do it. The high interest will activate it. Now, I'm going to talk about some ways on how to work with this legally and constructively as we go. It's difficulty regulating emotions, getting easily frustrated or overwhelmed to an extent that affects personal and work relations, difficulty retaining instructions. One of the things that is hardest to do, but really important to do with ADHD, is simply paraphrase and write your instructions down. That is much easier to say than to do, and if you have it, you're going to have to practice and practice it in order to do it. And then low self-esteem comes because of all these tasks not finished, and you evaluate yourself through the lack of tasks being completed in your life. So, in summary, the way to understand this is this is an attention variability syndrome or a disorder, and your attention varies between high and low interest. So I'm going to spend just a few minutes on core behavioral activation skills. So I'm going to, all these are core things that you can do to move your brain from low interest to high interest. So I'll give an example. Someone is very bored with history, their brain shuts off. They can't retain what they do, what they're learning. But we have them at a stationary desk or a stationary bicycle, or they move before they read, and then their brain wakes up. This is often common, that you need to combine exercise and reading. Another thing you can do is move around your room when reading and talking out loud, because the voice will activate your attention. One of the fascinating pieces with this is also finding pleasant activities that are your strengths, and you move it literally into your low interest activity. So for example, I was working with someone who was flunking Spanish, but their high interest activity was listening to Hamilton, the musical, and rap. And so I had them, they could not learn Spanish, they were flunking out of Spanish, but I had them listen in one ear as an experiment, Hamilton, and the other ear, an audio tape of Spanish, and they were able to work with it and learn it just like that and got an A. There's numerous stories like this. So one of the other pieces that I remember, and I'll just end with this, is the most important thing is managing procrastination by setting start times. Don't focus on deadlines, starting on start times and putting it in your planner. Your planner is your second brain. The planner can be on your cell phone or a regular planner. So it's really good talking with you, and now we're going to just sit back and see if there's any questions.
Thank you, Professor Crosby. Oh my gosh, if you are listening, and I'm sure you have taken notes, you're going to want to replay this one a few times. Do you have any comments about, you've taught in our psychology program and our counseling programs for so long, 37 years, that's amazing, and thank you. Do you have any comments about how the learning process at Marylhurst has really helped people learn about adults with ADHD?
Well, I think in general, one of the things we try to do in teaching is make teaching come alive for you. So this isn't just transmitting information, it's like understanding, see how that information fits how you view the world. And so that transaction, I think, is a hallmark in adult education and at Marylhurst. And people come in the classroom with all sorts of interest in psychology, because at some point along the line, you're going, if you don't have it yourself, you're going to meet someone with something.
Well, and I can say engaging in classes with you, you keep the class kind of moving and up and down, and dialogue and discussion, and then new information, and then practicing with it. And so I think that style is very wonderful.
Thank you. Well, I move it to a multiple intelligence learning style where you can be visual, auditory, analytical, interpersonal, and I will have physical exercises as well. So I bring it all together, because at some point we have to internalize it in ourselves and what our learning is, but we need different ways other than straight lecture.
So true, and I can vouch for that. Dr. McGarry, do you have any comments about the program highlights?
Right. Well, I think that, Professor Crosby really touched on a lot of important things about adult ADHD and the changes in diagnosis. And I know that he has a special class that addresses a lot of these issues. We also see these issues in a number of our other core undergrad courses, such as developmental psychology, child and adolescent psychology, interpersonal neurobiology. So this topic is very prevalent. And, you know, Marylhurst, I actually was a student here years ago, and Professor Crosby was one of my instructors. And I remember how engaging he was in the classroom, and I think that's really important for students. I think the in-class experience here, like he has mentioned, is very hands-on. There's a lot of demonstrations, presentations. We also use Canvas as our online platform for videos, visuals, and discussion forums. But our faculty are excited to teach, offer assistance, and they desire to help students apply theory to everyday life experiences. And I think that's what's unique about Marylhurst. We really want students to learn, but also apply what they learn. And we're designed to help students achieve their bachelor's degree here, but also while they're working, which is also a unique component of the Marylhurst experience. We value that work experience.
So I think do we have a couple of questions that have come? We've just got a couple of minutes to go. This is so interesting. We could go another half hour or hour, I'm sure.
Looks like we do have one question that came in from a listener. It reads, just found out I have ADD. At 61, it explains a lot about my life. I do not want to take the drugs. What is your opinion of Ritalin and Adderall?
Well, I'm not a nurse practitioner or a psychiatrist, so I am saying that you need to check if you use those medications with your doctor, if it's fitting your health needs. But the key thing that is overlooked is the skill set. And that skill set is, I said in the last slide, but it's very detailed with exercises in transforming adult ADHD that I co-authored. So that might be something to check. It's on Amazon. It's in most bookstores.
Mm-hmm. And it's called Transforming
Adult ADHD.
Right.
Adult ADHD.
Yeah.
It's the cover was at the very first slide.
Yeah, I think we see another question.
Yeah, so if another question came in, if you have ADHD as a student at Marylhurst University, do you receive accommodation?
Yes.
And what does that look like?
Well, it's very to fit your needs. One of the important changes in the civil rights law is accommodations. It's called ADA. And so you sit down with a representative who's qualified at a college or a university to go over, if you have ADHD, what the accommodations could be. Common accommodations are extra time in tests. It could mean technology devices like Dragon Software Speaking. It could mean potential extra time in writing papers. So it's all varied from person to person.
Right, and I've had experience with students also getting extra breaks. They might have to leave the classroom more frequently, so that's also something, that you would work out with accommodations. Yeah.
Helpful to know. Well, we've kind of come to the end. I knew this would go fast. And certainly if you have questions, feel free to reach out to us at the Office of Admissions. Our email and our phone is there. Again, Donna Davis in Admissions, happy to talk with you about our program, either in psychology for our undergraduate bachelor program or our Master of Arts in Mental Health Counseling. We are taking applications now for both, and we'd love to talk to you. And I think with that, we'd like to just say maybe thank you for joining us today. We hope you've enjoyed hearing from Professor Crosby on this important topic, and we hope to hear from you.
Yes, thank you.
Yeah, thank you very much.